the Lifestyles Update. It's a pleasure to introduce at this time Dr. Jason Denny, who is the Senior Staff Surgeon at the Henry Ford Transplant Institute for the Henry Ford Hospital Department of Surgery. Please welcome Mr. Denny. Dr. Denny. About 10.
10, okay. Sure. It's always good to be in the right place at the right time. Sometimes you just get dropped off there. I was born in South America, grew up in New York, and somehow wound up in Detroit. And I always feel like I'm in the right place at the right time. And to be here, listen to all these people and all the people you represent and the work you do, I feel like I'm in the right place at the right time. So my name is Jason Denny. I'm a transplant surgeon. I work down at Henry Ford around the corner. And I represent a few organizations. Hopefully I can work this mouse good. I'm the surgical director for living kidney transplantation. And usually when I first say that, sometimes people say, well, that's not really affecting me at this point. I'm pretty healthy. I walk, I eat fries only on Tuesdays and Fridays. And they feel like it doesn't affect them. But by the time I'm done, you'll see how it touches everybody. Okay? I always like to center myself. You reach a certain place in life and you feel like you've done good, and you got to remember that there's always links in the chain. Okay? If the NAACP had been here for X number of years, there's links in the chain. You see them on the wall. And the links in my chain, how I got to be where I am, are these people. There's only probably 50 African-American transplant surgeons in the United States, of which I think I was number 36 or so. And my brother's number 35. Wow. He's a smaller version now. I'm like the Escalade. He's kind of like a DTSTS or something like that. But this book here, Century of Black Surgeons, changed my life, chronicled the history, and somebody mentioned Howard University, which is very instrumental in their hospital in educating African Americans in medicine when there was no other opportunity. So I always like to center myself there. A couple of organizations I'm involved in and information that I will bring you today. The 100 Black Men of Greater Detroit. I'm the chair of Health and Wellness. We have a run, walk, and an educational event on August 6th at Wayne County Community District at Outer Drive. Our event has moved from just being the Man Up for Health, where we check people for prostate cancer with a simple blood test, all the follow-up. It's all free, no copay, you just show up. Homeless, no insurance, whatever it is, we'll take care of you on that day. We've expanded that with the help of Blue Cross Blue Shield to really expand to take care of entire families. We have education on podiatry, dentistry, STDs. We do HIV tests. We do all blood tests, discussions on BMI, diabetes, anything that you could think of, the children's ID. We cover everything that there is, and it's at an educational place, and we would like to even expand it more. Healthy eating, Zumba, yoga. If you name it, it's there, and every year I try to expand it to whatever the needs are of the community. And this is a great event, 100% free. Another event I'm in is I'm the chair of the Detroit Motep Foundation, which is the Minority Organ Tissue and Transplant Education Program. And we basically support the education in all communities along organ donation. And I'm going to talk about that for the last several minutes of my talk. We have a walk at Belle Isle, and that will be July 30th. Your vehicle does need to have that passport to get on Belle Isle, I believe. I don't know if we have a few exceptions. Maybe Tanya will know that. And that's an amazing walk. We have education, entertainment, and if you talk about touching, you talk about intimacy, you talk about how, you can bring someone, when we were voting originally for Obama initially, when many people were really, engaged, picking up an old lady who maybe you never talked to, who lived down the street from you, and driving her to the polls. People were getting connected where they weren't connected. Well, in transplantation, you have a piece of your body in someone else. I've had a woman whose son died tragically. She donated his organs, and she got to listen to the heartbeat of her son in another man's chest. Wow. Now, I'm about 6'1", couple 100 pounds, big guy, and I'm sitting there like, that's very nice. That's very nice, because you don't really see how you can touch people even when you're gone. We spend a lot of time focusing on our relationships when we're here, and we have a lot of concerns, and there's a lot of myths, and I'm here to answer all those questions as well. So we'll be having that walk on July 30th. So in the 100 Black Men, I'll just update you in a few things. They will be what they see. This is our motto. We provide an excellent example for these young men. One of our three major things are mentoring, health and wellness, and the Man Up campaign, and we work with Blue Cross Blue Shield there. Education, you see an oratorical contest where the young men get up and they give speeches. They're graded and we award them there. And Project Success Mentoring is one of our greatest achievements there. We are affiliated with Southeastern High School. The graduation rate for young men at that school was approximately 25 to 35%. All the men in our program are almost 100% graduated. And that goes to show that with the proper environment, success is achievable for everybody. And these are just some pictures from the different events. There's a Zumba class going on there, some of the young men at the NAACP dinner, and us receiving a check, which is always nice, from Blue Cross Blue Shield. One of our members wrote a book, Dare to Be Extraordinary, about fathers, about how to be a great father. So transplantation. What is transplantation? Well, if you're like me, it's the world. All medicine is transplantation. But in reality, transplantation is a very small piece of medicine. Most of you have never seen a transplant surgeon or needed to see a transplant surgeon. But when I ask people in the audience, who knows someone who has high blood pressure? Just raise your hand. Okay, that's almost 100%. Who knows someone who has diabetes? Okay, there's 2 zip codes in Detroit that have the highest rate of hypertension and diabetes in the United States, secondary to North Carolina, 2 districts in North Carolina. 50% of the people on the waiting list for a kidney transplant, now we're not talking about any of the other organs right now, just kidney transplant, have hypertension and diabetes. That does not mean that everyone with hypertension and diabetes will need a kidney transplant or need dialysis. But it does mean of the people who do need it, they have hypertension or diabetes. Now there's other reasons to get there. So when I say that, now you're thinking, okay, I'm only 1, 2, 3 people removed from knowing someone on dialysis. Who knows someone on dialysis? Oh, even more so. Okay. So it's very, very personal. And when we put our heads in the sand about organ donation because of things we don't know, because we may not be in the system. This is what I tell my colleagues at work all the time. Certain communities don't look at the system necessarily as their friend. They use the system only when they absolutely, positively have to. If they didn't grow up with a pediatrician giving them a lollipop and bouncing them on their knee, they went to a cold building with cinder block walls, they don't look at the hospital as a place where they can get the care and love that maybe other people look at. And I think that's very important. So when you come in and you're talking about Uncle Billy died, he's not coming back, and someone approaches you about organ donation, you don't necessarily look at it that organ is going to go into a pool to help someone in your community. You kind of look at it as the hospital is taking something from my family in addition to Uncle Billy who passed away. And it's very important that we bridge that gap because the main reason that people are on the list dying is lack of donors. People just not doing it. They die and it's easy to do nothing. So we already discussed that it's very likely that in your personal and professional life that you will encounter someone who needs an organ. And this was very funny. When Obamacare was coming out, Al Sharpton, who I see on the wall, he was on TV talking, and people were like, I don't know about this Obamacare and the money and this and that. And he said, it's not about Obama, it's about yo mama. And I thought it was hilarious because at the end of the day, I've had people come up to me, I don't know why I'm the Obama representative, and say, well, I don't want to pay. I'm being fined. And I tried to explain to this particular person who, made a very modest salary. I said that, what you pay me to see you based on your insurance is very low. I said, the people who are organizing the Obamacare are really trying to help you. So even the people that it was designed to help have been uneducated, or if that is a word, out of the process to help themselves. And I'm not saying it's a perfect system. I'm saying that it's a start to do something for people who are uninsured and just show up to the emergency room with whatever the ailment is, which costs much more. So some statistics. In terms of African Americans, 12% roughly of the population, okay, but almost 50% of the people on the kidney waiting list, okay? 12% of the population, but 50% of the people waiting. And primarily that's because we have a predisposition to those 2 diseases that I mentioned, hypertension and diabetes. Those are the 2 biggest things. So you can see that in terms of organ donation, just by participating in terms of either live donation, which I do a lot of, we'll do tomorrow, and even deceased donation when you're gone, you are directly affecting your community. I like this slide because that's ultimate teamwork there. I don't know about the guy in the bottom, but the guy in the top definitely is getting a helping hand. Transplantation is a huge process. We have nurses, we have medical assistants, medical doctors, surgical doctors, just to get one transplant done, because we have to scrutinize the patients so much because of the medications and the things that we give them, and we want this organ to work for a very, very long time. So we can't necessarily give it to someone who is unable to obtain the medications or meet the requirements to come to their visits. Every 10 minutes, somebody's added to the transplant waiting list. When transplant was not successful, or early on in the 50s and 60s, well, many people just kept their patients on dialysis. Doctors wouldn't refer. Now, transplant is the actual direct solution to people with kidney failure. So now the waiting list has increased as all those people come to me for kidneys, but the amount of kidneys to offer them has decreased. So as I mentioned, nearly half the people on the waiting list are African American. 25% of the total donor pool are minorities. And we'll try to increase this. Now, unlike bone marrow, the match does not have to be so exact that it has to be relative per se. Anyone can donate in live donation, and in deceased donation, just about anyone also, without active cancer or something like that. And recipients can vary. My oldest recipient is 80 years old. We have used organs from donors as old as 85 and 90 years old. So there's very few reasons for you to be ruled out. And there's many things to be used. I mean, there's kidneys, there's liver, there's lungs, there's a variety of things. So you see here the increasing volume, and the wait time for a kidney in the United States is roughly 5 years. So for the economists in the room, as I close this up, this is a busy slide, but it basically tells you that the incidence and the prevalence of kidney disease in the United States is increasing. And this slide tells you the cost. The cost to keep someone on dialysis is much more than the overall cost to transplant, and that's why Medicare will pay for a kidney transplant. So it's also economically feasible, which is not often the case for many things that are good for people. These are some of the people who've donated to one another. A lot of local people, local attorney. This guy lives down the street. This is a football coach and his assistant coach, father and son, father and daughter. One other thing about, if you ever hear about, I don't think I match. One, never assume you know your blood type. Most people think they do, and it's usually incorrect. Few people do, sometimes military and otherwise. But even if you don't match, we can do a swap. So if you would like to donate to her, but you don't match, we'll send your kidney to Texas. Texas guy in the exact same situation will send his kidney to her, and now both people are not on dialysis. So there's always a way. Technology has advanced. We use robotics a lot now. Henry Ford actually is the only place in the Midwest and certainly in Michigan that are implanted kidneys robotically. And we often take kidneys out robotically as well. And just to give you an idea what the incisions look like, that's what the robot looks like. It looks a little busy. There's a patient underneath there. And the person sits at a console separate from the patient. And this is the standard open incision, about 8-9 inches. And this is the robotic incision. And then this is after several weeks. You see almost nothing, and if it's hairy, nothing at all, like we never touched them. So I'll leave you with that. I'll take questions if that's allowed. Just remember the Gift of Life MOTEP Walk, July 30th, and the 100 Black Men Man Up for Health, free health screenings and education, completely free. Even if you have a doctor, completely free. Thank you very much.